I'm going to introduce a few of the folks that are going to be speaking to you here today. Obviously, we have Superintendent Tom Horn. We also have, I just mentioned her, Dr. Holly Geyer from the Mayo Clinic Scottsdale. She is the co-chairman of the Stop It Task Force. Is Kate Dobler here from Access? Come on up, Kate. Thank you. We're very pleased to have Access participating. Elizabeth Marcona from the Department of Health Services. They are very central to this effort. And then, I don't know, is Rebecca Beebe here from the Arizona School Administrators? All right, well, if she's not here, we want to be sure and give them thanks for their help with this as well. We also want to give thanks to the Department of Health Services, again, Jenny Kunico, the Cabinet Executive Officer at DHS, and Major General Carrie Muhlenbach from the Department of Emergency and Military Affairs, and Colonel Scott Heyer is here representing them today. So and also Representative David Marshall is joining us as well. So did I miss anybody? If not, you can beat me up later. So I'd like to present Superintendent Horn. Thank you.
Okay, so thank you very much for coming. It's not often, maybe shall I wait for the plane? I didn't realize we were in a flight path. It's not often we have the opportunity to do something that's likely to actually save lives. So this is a great morning because we are announcing a program that is likely to save lives. It's a terrific program, result of a terrific partnership. Some time ago, I started a working group called Stop It, and Stop It is a acronym for School Training Overdose Preparedness and Intelligence Task Force. Today, we are here to celebrate a tangible outcome of the work of that task force. Thanks to a partnership between the Department of Education, the Arizona Air National Guard, Arizona High Intensity Drug Trafficking Area, Arizona Department of Health Service, and the Arizona Healthcare Cost Containment System, schools across the state will receive shipments of the life-saving drug Narcan starting today. And this is all paid for. It's free, entirely free to the schools, of the school districts, and the charter schools. Stop It has been working diligently over the past 6 months to address the opioid crisis in our state. The diverse composition of the Stop It Task Force, which includes over 60 representatives from various public and private sectors, highlights the collaborative effort required to tackle this complex issue. With involvement from medical professionals, law enforcement, education leaders, and families, Stop It is well positioned to develop effective policies and resources tailored to the unique needs of our schools. This cross-disciplinary support is critical in promoting standardized practices, particularly regarding the administration and accessibility of naloxone. That's the drug for which Narcan is a trade name. The life-saving opiate overdose reversal drug, which despite existing laws allowing its use, remains inconsistently managed across our schools. Now, if somebody has an overdose and is in school, Narcan will save their life. So we want to be sure this is in every school. The one thing we don't want ever to happen is for a student to die in a school. You lose a life, his parents will never recover from that. The other students would be traumatized. We want to be sure no one ever dies in a school, and this program will enable that will enable us to prevent that. On October 15th, ADA staff advised superintendents and charter school representatives of the opportunity to receive Narcan kits at no cost. On November 1st, we got to get our legislators to change the flight paths up there. On November 1st, ADE received a shipment of 16,200 Narcan kits that was procured by the Arizona Department of Health Services. Since that shipment arrived, my staff has been boxing and bagging these kits for distribution to schools located in every one of Arizona's 15 counties. Thanks to a partnership with the Arizona Air National Guard, members of the Guard and staff from ADE are distributing this Narcan at this very moment. While the Stop It Task Force's work isn't done, today's distribution of Narcan will undeniably make our children safer, from while hopefully giving parents peace of mind. So now some other people are going to speak, and then we'll be happy to take any questions that anyone has. So our next speaker is Stop It co-chairman Dr. Holly Geyer, addiction medical specialist at Mayo Clinic, Scottsdale. Holly.
Ladies and gentlemen, it is an absolute privilege to be with you here today to offer what will be the first of 3 major installments coming out from the Stop It Task Force. You know, it's often been said that you know where people's values lie based on where they offer their investments. And these individuals behind me have invested their time, their energy, even their off days to make today a reality. What we're delivering is far more than just a drug, far more than a life-saving medication. We are delivering hope to every parent that can't sleep tonight because they're concerned about what their kids might encounter in their schools. What we're delivering is an education system that's coming shortly to our students to make sure they know what's in the pills they take, to make sure they know not to eat candy off the street, to make sure that all of these sadistic tactics being used right now by our cartels to rope in our kids don't fall on preyed ears. We are so excited with these partners today to be standing with you in the first step to saving a life, and there will be many saved. Naloxone is a life-saving medication. It rapidly but temporarily reverses an overdose. It has no addiction potential, and in itself has the opportunity to make sure that a person has another chance at tomorrow. We're so grateful that we are offering large quantities and reproducible, replenishable quantities to our state school systems and beyond. The second installment of our Stop It campaign will be policies, procedures, all built into a large toolkit available to our schools. This will be released in January. We are so excited about this coming out because this has national potential for other school systems and organizations across our country that don't have current resources. Our final installment is probably one of our most exciting components to this campaign, and it is a standardized educational school platform training that will teach our kids, regardless of whether they're at home learning or in a school environment, on the basics of opioids, on the current status of the epidemic, on how to offer naloxone, and what to do during an overdose. Let's prepare the next generation for the current opioid epidemic. We are done losing our kids to this crisis. It's time to stop it. Thank you.
Thank you. Our next speaker is Kate Dobler, State Opiate Treatment Authority for Access. Kate?
Good morning, all. It is an incredible honor and privilege to be with you here today and to be working with this team behind me to really implement this innovative, creative, and first of its kind distribution of naloxone to communities and schools across our state, reaching families and children in the schools and their communities that are the hearts of life, particularly in our rural, small communities that are far away from large hospital systems, government, and other sources of naloxone. The collaboration that was made possible through this team is incredibly heartwarming, and I am blessed beyond to be part of this work, and I'm so happy to be here to see all of this naloxone behind me and to know that we now have an opportunity and a mechanism to keep our kids safe, to keep naloxone available in schools so that families and community members have access to it. When we know families come to schools for community events, for football games, for parades, for homecoming, for graduation, for all the things that make life as we know it in our communities, schools are at the heart. And this provides an opportunity for us to keep our kids and families safe. Thank you so much.
Thank you, Kate. I'll wait for the plane. Plane passes and a truck comes. Oh, thank you. The next speaker is Arizona High Intensity Drug Trafficking Area Executive Director Dawn Mertz. Dawn?
Good morning. In our country, approximately 300 lives a day are lost to drug poisoning or overdose. An opportunity to save a life is why we are here today. My name is Dawn Mertz, and I'm the director of the Arizona High Intensity Drug Trafficking Area, also known as Arizona HIDA. HIDA is a grant program funded through the Office of National Drug Control Policy. And the primary purpose of HIDAs is to bring federal, state, local, and tribal law enforcement together to address the drug trafficking organizations operating in our area. Arizona HIDA provides funding to 25 drug task forces and brings together the efforts of 685 participants from 83 agencies from federal, state, local, and tribal law enforcement organizations. Nationally, HIDA partnered with the CDC to develop the National Overdose Response Strategy. And basically, that partners a drug intelligence officer with a public health analyst in every state in our country. And the whole goal of these overdose response strategy teams is to save lives. Our team participated in the Stop It Task Force and helped procure naloxone for elementary, middle, and high school districts statewide, including charter schools. It is extremely important that naloxone be readily available as needed and not be placed under lock and key. As Director Horn said, the Department of Education has received 16,200 doses of naloxone, which will be distributed by their personnel and the Arizona National Guard personnel throughout our state. Today demonstrates the power of partnership, working together to save lives. I would personally like to thank Director Horn, the Mayo Clinic, Arizona Healthcare Cost Containment System, Arizona Department of Health Services, and the National Guard. We hope drug poisonings do not happen in our schools. Having naloxone readily available may save the life of a student, a school district employee, a parent, a loved one. So thank you all.
Thank you, Dawn.
Thank you.
So now we're happy to take your questions. Mike, we might need you for that. Anybody have any questions? Yes.
You mentioned that this is free to schools. How many schools are going to benefit from this, and how are you choosing which schools are getting a kit, or how many kits each school gets?
It's available to all the schools, and we sent emails out, and it's going to be given to every school that requested one. I don't know, do we know, Mike, how many accepted?
Good morning. My name is Mike Kurtenbach, Director of School Safety here at the Arizona Department of Education. As the superintendent said, we sent out a blast to all of the schools. My team created a format where the schools could request that. In fact, I was up in Coconino County yesterday just delivering to that county. So we have roughly 4,000 kits that are going out today. Clearly that means we have a lot more. We're hopeful that through this process today we'll be able to get the word out. In fact, if I could just share while I'm up here, stopit.azed.gov is how these schools can order more kits. Thank you, sir.
Oh, did you have a follow-up? Or?
Yeah, I guess a different question, but how big of a problem is this, or do we have any kind of statistics or data that says how many overdoses there have been in schools?
We don't know of any in the schools, but But among the population, we do have young people. You have those numbers?
I do. We know in the state of Arizona, we have 4,000 overdoses annually. A substantial portion of those are kids. Now, unfortunately, there is no standardized mechanism for reporting of when an overdose occurs on a school campus, and so much of this has been extrapolated based on a lot of discussions with schools and what we can gain from the Child Mortality Review Board. What we do know is that between 2021 and 2022, we lost 80 kids in our state due to overdoses. We know last year there were more than 180 kids that had a near-fatal overdose. This is occurring on schools. In fact, one of our initial nituses for initiation of this subcommittee started with some information we had gotten about school teachers being afraid of letting their kids lie their heads on their desks due to fear that what they were seeing was an actual overdose. There is actual problems in our schools. We are hopefully building a reporting system that will come out of Stop It that will help calculate these numbers moving forward.
Okay, now correct me if I'm wrong, but it's my understanding that we're not aware of any child actually dying in a school so far.
Those numbers have not been collected, so to the best of our knowledge, we can't report on those. There are suspicions, but I don't know.
Okay, yeah, we haven't heard of any, is the point. Okay. You had a question. Okay, yes.
Is the idea that the Narcan will be distributed to the teachers and the staff to be used on the students, or will the students be given Narcan to take home with them?
No, I think the Narcan will be in the school office. Is that right, Mike?
So to answer your question, it's not being given to the students, it's being given to the staff. We're providing direction to the staff, roughly one kit for every 300 students, but also one kit for every building, understanding that a lot of our high school campuses are very large, and we don't want them to be under lock and key, as you heard earlier, and we don't want them just to be centralized in, say, the nurse's office. We want them accessible throughout the campuses.
But it's up to the school districts to figure that out. Is that right?
We provide guidance, but yes, ultimately it is up to the schools.
You talk to guys as in how to instruct them to apply it if needed?
No, with regard to the application, what my school safety team has done in partnership with Access and ADHS is provide a simple QR code that will take you to training on how to administer the drug. What I was specifically referring to is where it should be available on the campuses.
We've heard from fire departments who have dealt with overdoses before, specifically with fentanyl, and they say that a lot of the times when people are experiencing an overdose with fentanyl, they have to administer at least 2 naloxone or Narcan.
That's correct. That's our calculation also. A kit consists of 2 applications. Anybody else? If not, thank you all very much.